Hi, my name is Valeria Gentil, and I will be presenting my project, which was the effectiveness of reciprocal imitation training on spontaneous imitation. My participant is Lila. She's a 5-year-old girl diagnosed with autism spectrum disorder, and she was diagnosed on December 2023. Based on assessments such as VB maps and Vineland assessment, we were able to determine that her cognitive level on average is between a 2 to 3-year-old. So coming into the center, we were able to see that Lila had zero imitation skills and her vocal commands, not a lot of social interactions with adults or peers. It was also noted that there was a lot of trauma from the school setting, so very limited interaction with adults. Um, this was a clinic setting and early intervention. So she was a 40-hour client, and 8 hour of supervision coming into the center from Monday to Friday from 8 a.m. to 4 p.m. So based on just the information that I provided, I really wanted to focus on one of the things which was imitation skills, which can develop for, other skills that we can work on. And I consider it more so as a prerequisite. So the research question was, will the implementation of reciprocal imitation training increase that spontaneous imitation? And the reason why this was chosen, just because reciprocal imitation training will kind of broaden that social communication, including like joint attention, delayed language development, and challenges in social interactions. So being able to imitate the child kind of brings that trust and engagement where they will start imitating you. We use naturalistic teaching, which uses real life situation and promote learning and makes teaching more meaningful and engaging. And that's one of, obviously our biggest goals in ABA is to make teaching meaningful for our clients, but also in a way that they are learning to gain those independent skills, those social interactions, and that communication and language development. So my independent variable is reciprocal imitation training and dependent variable, the level of spontaneous imitation. So the way that I tracked this was trial, so the frequency of spontaneous imitation, and I used the data entry that we use for my clinic, which was called Passage. A preference assessment was conducted to kind of determine that motivation and reinforcers for her to kind of use during treatment. So based on figure one, we were able to see that food toys were really, really preferred for her. As well, she played with a xylophone, a Barbie, and a pony, but as you can tell, she really loved those food toys. So during baseline, Lila had limited attention to therapists, frequent disengagement during play, and would kind of move away from social engagement. So BT would just kind of like start playing with her. She would kind of move away, engage in tantrum behaviors just because she wasn't used to that engagement. Also, she didn't really like it. Um, so during reciprocal imitation training, what would happen is therapists would play with Lila and kind of imitate her behavior as well as providing that instruction of, oh, like do this. And like, I don't know, maybe she's playing with the fruit toy. We break the fruit toy, we pretend to eat it. So that will use her reinforcers into skills that we can teach. So therapists will kind of present the SD of do this while playing with an item. And if Lila imitates, we mark as correct. But if she doesn't, then we would present the SD again and go for a physical guidance, so physical prompt. And then after that, kind of fade it away. So do prompt fading. During treatment, as we can see in figure two, during baseline, actually, we saw that there was maybe like one or two imitation skills, but very limited. Um, for treatment, during treatment, there is like a little bit more engagement with therapists. We can see that she kind of started trusting the therapist and seeing like, oh, okay, like you're imitating me, so I'm gonna start imitating you as well. It became very fun and engaging for her. She kind of initiated more attention seeking from the adult and also demanded for continuation of play. So it became reinforcing for her. So as we can see during treatment in figure two, we kind of started low and then there's an increasing trend, which was pretty cool to see. Um, for this graph, I used an ABAB design, which I wanted to see the clear picture of how the behavior changed with and without the intervention. So that's why we have that baseline treatment, go back to baseline, and then go back to the treatment again. So it kind of helps confirm that effect of the repeating the pattern of going to baseline to treatment. So as you can see in figure 2, we do kind of see an increase of spontaneous imitation, and which was linked to the reciprocal imitation using play-based skills, specifically with object use. So in treatment, we see that they started off kind of low and then slowly increased, going back to baseline. We do see a pretty high point and then decreases. During treatment, again, it had a rapid increasing trend, as we can see. So it was really nice to see as well. And again, we were tracking that frequency of imitation. So overall, based on the results, we were able to see that Lila demonstrated an increase of spontaneous object imitation during play. As seen as figure 2, it illustrates a clear upward trend in that imitation frequency. Not only that, data is really important to see whether or not, behavior is changing, but even during direct observation, it was confirmed that there was an increase in social engagement, which was likely correlated to those imitation skills that she was learning, but also that naturalistic teaching that used her reinforcers to, increase that spontaneous imitation skills. We can see that now Lila was really engaged in whatever she was doing, seeking that imitation from the therapist. So she would start dancing and then kind of wait to see if like the therapist will start imitating her. And then therapists would kind of do like some sort of fun game with objects, and then she would start imitating the therapist. So we did kind of see that increase of social engagement. Those improvements also supported instructional control during one-on-one sessions. Although this project really focused on that spontaneous imitation, and we can see that other skills were also improving as well, such as instructional control. During the intake process, when you would give an instruction to Lila, such as like do this or transition to a location, like we have to go this way, she would engage in behavior. So increasing that instructional control was really important, and we did see that during reciprocal imitation training, that instructional control was being gained by the therapist. So some of the barriers or things that we can, focus on was the time constraint limited to progression. So of course we can see in figure 2 that on session 13 and 14, we were to see some zeros, and that was correlated to her being out. Again, things happen. So, that was one thing that was to be considered, is that she might be absent. So that was one of the things that I had focused in my time constraint, limited to progression, that I would have liked to see more data, more fluency of how things would have gone, with more sessions. Um, Another thing is that object imitation served as a prerequisite skill for that echoic imitation and increasing her echoic repertoire. So I would like to kind of continue on with the imitation and kind of move on to that language development and communication. So again, this was a prerequisite skill for her to learn imitation through play, through objects, and then we can kind of gain it from language development, echoic repertoire, and things like that. But I do see an improvement in her imitation skills that can kind of show the readiness for echoic imitation, which I do think could have been targeted with the extended intervention. So in conclusion, the implementation of reciprocal imitation training effectively enhanced spontaneous imitation, which is such a foundational skill for promoting social interactions, language development, and overall skill acquisition. And then we were able to see that using the ABAB design in figure 2, that there was an increase in treatment as well. But yeah.